Hi, my name is Camille Connect. My second career profile that I chose was a child life counselor or specialist. I didn't have a career contact for this career, but I found plenty of websites that helped inform more about the career and gave a lot of explanation as to what a child life counselor does. One of the organizations I found that gave a lot of information was called Child Life Council, and their website is childlife.org, and they give information to professionals, to families, just so many resources on helping improve child life counseling and specialists. The purpose of a child life counselor is to help children and families in kind of crisis situations or stressful situations, particularly in medical settings, so in a hospital or more recently in rehabilitation centers or hospice centers. They do typically work in hospitals, and their typical hours are usually just during the day when most people are awake. Children are generally awake, 7 a.m. to 7 p.m., somewhere in there is typical hours. Occasionally they could work in emergency room settings with children at night times or weekends. But because the hours are generally during the day, it's not the most family-friendly career in having a family. But that is the typical setting of the work environment. The stress that can come from it is, the purpose of the job is to help families cope with stress, help children who are going through a stressful time of medical procedures, help them deal with the stress in the family. So you're taking a lot of the family and child stress onto yourself. And so that could be a pretty big stressor for a child life counselor. They do typically get benefits. A study I saw, or a report I saw from 2008, showed that about 95% of child life specialists reported receiving health care coverage through their employees, and more than 90% receive dental benefits. So it's a pretty high percentage of those that receive healthcare coverage, probably because they work in a hospital setting and are hired by the hospital. Common job tasks are to teach children about and prepare them for medical tests and procedures, provide kids in the hospital with opportunities to do normal everyday activities, like play and do crafts, or be with other children of their own age, which is probably very comforting for the children because they have similar struggles. So they also provide emotional support for parents and family members who are having a hard time with this for their child. And the child life professionals work collaboratively with nurses, doctors, social workers, and chaplains in the healthcare team. So it's just a collaborative effort for the children going through this. The educational requirements are a minimum of a bachelor's degree in a related child development field or family and child development field, but a master's degree would help as well. Starting salary as of 2008, that's the most recent average salary I found is average $39,000 a year. And if you work and have at least 4 years of experience, you could be making up to $41,000 or $42,000. And with more than 9 years of experience, it's around $46,000. One of the requirements to be a certified child life specialist is to have 480 hours of internship experience. And so that's necessary in order to be certified as a child life specialist. I found some resources, like I said earlier, at the childlife.org website. And also I found some information on the Mayo Clinic website in what they look for in a child life specialist. So that is my research.